and there was lots of pressure on beds and just like getting people in and out as fast as you can. So that was quite stressful. In terms of coronavirus, they were like, oh no, we've only had one patient with coronavirus this whole month, but to the end, this last week I saw 3 people who tested positive for corona, so that was kind of scary. But yeah, in somebody who has visual deterioration, if they start having hallucinations and they know that they're not real, and it's normally visual hallucinations of small people, then that's Charles Bonnet syndrome. Sounds really random, but it's a real thing. And I saw it on placement. Hello and welcome back to my channel. My name is Jessica Katanga, and in today's video I am going to be talking about the placement that I've just finished, which is my placement on emergency floor. So I'm just going to be talking about what that was, the patients that I saw, and just other interesting things. I've got a cup of tea, as if there's going to be tea. There's not, but you know, if you're interested, then stay tuned. So I spent 4 weeks on emergency floor, and that's basically the acute medical unit where everybody who's come from A&E goes to the emergency floor to be either sorted out quickly and discharged, or if they are going to need more, like to stay in hospital for a night, we have to figure out which ward they need to go to, what needs to be done to them acutely, so in the short term, and then where they need to go in the kind of longer term. And so it was really fast paced. It was a lot of fun, and I learned a lot because it was a really broad range of diseases. It's just anything that rocks up to A&E. Yeah, so it was a little bit tiring, but I learnt lots because it was really general, so it was a good one to be on. I was clerking the patients, sometimes in A&E or sometimes in AMU, and clerking just means when you take like a history and examine them. And then I would write up, because I'm now in final year, I'm expected to kind of do what a junior doctor would do. So I would talk to the patient, examine them, then write that down in their notes, write down their past medical history, their medication history, and then I'd have to pass that to an F1 so they could prescribe their regular medicines if they're going to be staying in hospital for a long time. And then every patient also gets prescribed oxygen, because if oxygen is needed later on, then the nurse can just put it on instead of waiting around for a doctor to prescribe it first. Also prescribe DVT prophylaxis, so deltaparin, so that clots don't form, because a lot of these people are going to be confined to their bed and rest can make a DVT form. And then also and paracetamol, so just a very basic painkiller if they need it. And then what else? And then afterwards, each patient would get post-taked. So after I'd written everything down in the notes, then I'd have to get a consultant to then see the patient with them, and the consultant would be like, okay, yeah, what you made in the plan makes sense, or what you said in the plan, let's tweak it there. We're not going to do that for them, we'll do this for them instead. Yeah, and then that's what happens. So yeah, I was actually having to make plans for patients and everything, so that was a good learning curve. It was kind of stressful at times because near the beginning, so like a month ago, it was pretty chill on emergency floor, and in terms of coronavirus, they were like, oh no, we've only had one patient with coronavirus this whole month, but to the end, this last week I saw 3 people who tested positive for corona, so that was kind of scary. And because of that, then it makes the whole bed situation a whole palaver, because it makes a whole bay where nobody can go, so you lose those amount of beds, and there was lots of pressure on beds and just like getting people in and out as fast as you can. So that was quite stressful. In terms of some interesting patients that I saw, so I saw quite a few patients with alcohol dependency, and one of them was really jaundiced. Like, I've seen a lot of patients with alcohol dependency before, but I don't think I've seen a full-blown jaundice like that. And basically, so jaundice is basically where the liver normally filters things and makes bile, but then because your liver is so tired because of the alcohol insult that it's had, your bile just builds up in your body, and then you go yellow. And she was yellow, like her skin was completely yellow, her eyes were completely yellow, like this top. It was crazy, and really interesting. And then another one that I saw was a man with COPD who was very young, but you know, he had a really intense smoking history, a lot of pack years. So he had like the textbook barrel chest, where the chest was hyperinflated. So that was cool to see in person. And what else? I also saw, there was one diagnosis that I made where it was a man that had come in because he had fallen, and now I saw a lot of falls, but falls are actually kind of interesting because there could be lots of different things that cause it. And this man said that he felt dizzy, so I was doing a cranial nerve exam on his eyes, and he was like, oh, I've had this done before, lots of people have done it. And then now I asked him to look to the left, it was, and then I just saw like the most apparent nystagmus, and he got really, really dizzy, and then I was able to make the diagnosis of BPPV. So that was cool, and it just kind of taught me the importance of always being thorough with your examination, and taking a history, because you might pick up something that the other people have not, because at the time that they come to the emergency floor, they've already been clerked by the paramedics and one doctor in A&E, but we have to like keep on clerking them to see if there's any progress in their condition, and also just because the person before you might have missed something, or you might see something different, or you might see the same thing, and then that is like more confirming that yeah, that person has got that thing. And then also there was somebody who had a past medical history of macular degeneration, and then she was seeing hallucinations, and I made the diagnosis of Charles Bonnet syndrome, which is a really like random past medi type thing, but yeah, in somebody who has visual deterioration, if they start having hallucinations and they know that they're not real, and it's normally visual hallucinations of small people, then that's Charles Bonnet syndrome. Sounds really random, but it's a real thing. And I saw it on placement. My placement was far away, it was in the coast, so they gave us accommodation, so that was nice. I'll insert like a little video of what it looked like. And I was staying there with one other student who goes to my uni, and then another international student, and she was really nice, and that was cool. It was very convenient just to be living on the road of the hospital. Meant I could wake up late. Well, actually I was waking up early and I was doing workouts in the morning, so kudos to me. And yeah, but then the thing about travelling each weekend back to London was a bit long and involved. I don't like splitting my time up between two places. It's kind of confusing, but it was fine, and it was nice, and they're gonna refund me for my train tickets, so at least that's a weight off of my shoulders. Yeah, my overall opinion of this placement, it was good. It was a lot of teaching as well we got. So we also got simulation skills, which was really, really cool. They had like, they said £70,000 dummies to teach us like resus protocol and ABCDE emergency situations. So that was really vital. So I really loved this placement. I got taught a lot. Everybody was really friendly there, because I think it was like outside of London, so people are just a little bit more relaxed. And it was a good first one to get me back into medicine. And my next one is going to be GP. How am I feeling about that? Again, it's another general one, so hopefully I'll learn a lot. I know it's a little bit more, it might be a little bit more relaxed, I don't know. We'll see. Again, it's a faraway placement, so a little bit annoying, but I found a nice Airbnb, so that's good. That is literally just like a 10-minute walk from the GP, so that was a really good find. And we'll see how it goes. I know I'm going to have my own clinic room, so hopefully I'll have like a lot of autonomy over the patients, and I'll be able to actually make decisions for them, guided, overseen by the actual doctor. We'll see. My induction's on Monday. Yeah, so I'm looking forward to it. And that was the video for today, just me rambling with my cup of tea about what my placement was like. I hope you liked the video. If you liked it, like it, share and comment down below what placements you are going on or have gone on. and we'll start a little conversation in the comments section, and I shall see you in the next one. Bye.